Good afternoon, and thank you for coming this afternoon. On behalf of the American College of Sports Medicine, I'm very pleased to be here and delighted to be at Slippery Rock. I feel honoured to be invited for part of this event. You're doing some great things here. Were you not doing such great things? My time is so busy I wouldn't be able to. This is monumental what you're doing here, and thank you to the President and the Dean and all the faculty and new students that are helping make this happen. I would just apologise, my glasses are dark, and it's not because I'm trying to either look cool or because I don't like you. It's just that my other glasses broke before I got here, and so this is what I have at the moment. I'm getting them replaced. But one of my colleagues at the American College of Sports Medicine suggested that even when I get the new glasses, I should continue wearing these, because he said when you take these off, you've got a face that's perfect for radio. So, I don't know whether I'm going to take that advice or not. Many people all over this country have been talking about physical activity and its benefits for a long time, and when exercise medicine is not new. Let me just tell you why I think it is unique and why it's having such resonance. I'm not going to, you're not in class, I don't want to bore you with the science, but I want you to remember one thing if you don't take anything else away from this, and that is this, is that when you look at the science of what's going to most likely cause you and everyone else in society to die, in epidemiological terms, they're all cause mortality factors, and you look at things like hypertension, you look at diabetes, you look at cholesterol, you look at smoking, you look at obesity, the highest risk factor is physical inactivity. The only thing that even comes close is hypertension. It's about 9 times higher risk factor than obesity, physical inactivity. That's a 2009 study by Steve Blair, who studied fitness levels and measured directly on decades over 50,000 people. The science proves that physical activity is probably the greatest public health burden of this century. We have to do something about it. We really have to. So what makes exercise medicine as unique is that we believe that physical inactivity can't be an afterthought. It has to be integrated into the healthcare systems of this country and indeed globally. The idea here is that within a certain number of years, hopefully not too long, every time a patient goes in and speaks to their doctor, one of two things will happen. Either that physician will give you a physical activity prescription, and we recognise that doctors don't have more than 20 to 30 seconds to actually include this, but they really don't. But that is a simple message. 150 minutes a week of moderate physical activity is enough to prevent or treat chronic disease. That's enough, that's all you need. Physicians can deliver that message in 20 seconds. Or, if you need more behaviour change, that physician will give a referral to a health fitness professional. Some of you are here are training to be essentially health fitness professionals. You'll get a referral from a physician so that you can spend the time you need to change that patient's behaviour, give them the 6 to 8 weeks so it becomes an integral part of their life. And for those of you that are not in exercise science, I would tell you this, that many of your adult behaviours are formed while you're at college. Many who are athletes at colleges, after they leave college, they never bother to exercise again because they think of exercise as just for sport. I'm highly competitive, I love sport, but it's more than about sport, it's about health. It's about how you can not end up in a nursing home, not being fully functional. It's really important to be able to do that. I'm delighted that Exercise Medicine is finding a place on campus, and Dr. Winters and Dr. Lin are helping to lead that initiative here to really link up physicians and nurse practitioners, the healthcare system, to students who can give physical activity counselling, so that you can actually get this linkage of, we have to link the worlds of medicine and the worlds of fitness. They have to be linked for this to work. And here you're being a leader in the nation in making this happen. And I'm hoping that in a year's time you'll be able to report out what's happened and be able to hold this up as a platform of what's going on at Slippery Rock University here. Who would have known, right? To be honest, forgive me, I hadn't heard of Slippery Rock. But now I have, and now I see what you're doing. It's absolutely amazing. You're truly to be commended for that. So thank you so much. Please be part of making this a success, because what you're doing is not only of national importance, it's of international importance. Exercise Medicine has gone global over the last year. It's a 3-year-old initiative, and we have 6 regional centres after the World Health Organization model, 1 on each continent, that have been set up, and we're in 25 countries. And so even in the governments all over the world are recognising they have to do something about this. And to be perfectly honest, very few are doing as much as you are doing here on this campus, if you want to put it in perspective at the moment. They'll catch up, I'm sure, but you are one of the leaders in what you're doing. My congratulations to the folks here who are making things happen. Thank you, and it's delighted to be a part of this.